It was very difficult for me to understand the difference between tiredness and fatigue until I was diagnosed with AS and started to do a little bit more research. But as soon as you read someone else describe it as this fog, this haze, which doesn't leave you, regardless of whether you're having a flare or not, it's a case of you just want to shut the world off. You don't want to speak to anyone, you don't want to do anything, and that can be very difficult when you've got children and a job and responsibilities. The fatigue can really pull you back, and I think that's just as important factor for people with AS as the chronic pain itself. Flares are very difficult to manage. Sometimes flares creep up on me very slowly, other times they hit me with a wham. Flares feel like you're going to catch a very severe cold. It feels like your bones are on fire, your muscles are on fire. It feels very different from a normal pain day. Pain days can be good and bad, but flare days feel like everything's really hurting deep inside, and it's hard to pinpoint where that pain is coming from.
Flares tend to come out of nowhere. I've no idea what kicks a flare off. I'm not very good at always managing my flares because that's part of me being angry with the disease. The fatigue that you suffer every day is much worse when you have a flare because you're hurting so much that anything you try to do just wears you out because it's so painful. I can usually feel a flare starting to come on, but I don't always accept it for a couple of days. So suddenly my body will start to hurt a little bit more, and then one day I'll wake up and the back pain is severe and it's hard to get out of bed, and it takes a lot longer to get moving in the morning. One of the ways I do help myself with that is to take my pain control and my anti-inflammatories before I go to sleep, because then I find it's a bit easier to get out of bed in the morning. I have noticed that if I get ill with a cold or flu or any diarrhea and vomiting bugs, it does tend to, for me, set off a flare and my body hurts much more. Flares can, for me, tend to last anything from a week to weeks, but I never know, so it's very hard to manage your life. You make plans and then a flare will be set off and you don't, and that, things have to change. It might mean I don't want to go out for supper with friends, or I can't go and sit in the theatre in a seat for hours on end. I learnt very quickly that it was important to track my symptoms so that when I went for my appointment with my rheumatologist, I was able to then relay to him when I had a flare, how the flare affected me. I wasn't very good at it in the beginning because I didn't want to accept I was having flares. So I started to use a tool called Talking AS, where every time I have a flare, I can record my symptoms and my BASDI scores, so that now I can look back on that, because it is a graph and a symptom tracker. There are other tools that you can use to track your symptoms, and I would advise anybody to use it. They're quick, they're easy, and it just means you have a record then for when you go for your appointments at the hospital.
There are things that I do to try and avoid those flare days, because if I don't catch the flare days early, I could end up in bed for 3, 4, 5 days. My wife often spots the symptoms before I do. She might say I look a little bit hunched, or I might struggle lifting a cup of coffee. I might struggle tying my shoelaces. My wife will say, you need to do a little bit more stretching, you need to slow down, but you need to make sure that your body is getting the attention that it needs. So it'll be a case of medication on one hand and an alternative therapy route on the other hand. Flares for me often come when I haven't had massage or physio for a long period of time. So the first thing I'll do is have massage, have physio, try and swim as much as I can, try and walk up and down the pool even if I can't swim, just get the heat into my bones, get the heat into my muscles. But also, every single day, without fail, I stretch for an hour. It can't be shorter than an hour. There's a routine that I've found that works for me to stretch those muscles out. Combining that with my medication and my daily routine, it helps me control my AS as much as possible, because sometimes the AS can control you, especially when you work behind a desk for 6 or 7 hours a day, but take time to maintain my pain levels, if you like, at work, because it's very difficult to sit behind a desk for 6 or 7 hours straight, typing on a keyboard. Ergonomically, it's not perfect. I've actually got a stand-up desk in my office as well as a sit-down desk. But what I would say is try and speak to your employer. They will help you with comfortable chairs, possibly a stand-up desk. But there's also things that you can do as well. Set alarms to walk around the office, go for a coffee, go to the water cooler. I've actually got a treadmill in the office downstairs in the basement, which if I do get a spare 10, 15 minutes, I'll just go down there and walk. Just to loosen things off a bit. It's nothing strenuous. It's not to raise my heartbeat or anything like that. It's just to get the hips moving, my muscles moving.
I overcome these challenges by looking for ways to cope with the disease, and one of the best ways I've found is talking to other people who have the disease, and you can share how you manage it. So some people might have some advice for you. You can discuss how you feel, and it's good to know that other people struggle with it psychologically and physically. The NAS website gave me access to all this. Once I joined NAS, I was able to access lots of ways to help. You know, I got all the information I needed. There was tools. Because I became a member, I met other members who had the disease. We have the meeting regularly once a year where we can all meet together. And that's when I realised it wasn't all doom and gloom. We weren't all going to end up in a wheelchair. We weren't all going to end up with a fused spine. The disease wasn't quite like I'd imagined, even though I was a professional and I probably understood it better than most. I needed to talk to normal people who had, that weren't professionals, that were struggling to live their everyday life like I was.
But managing flares can be difficult, and I wouldn't want anyone to think that it's an easy thing to do, but there are ways that you can put programs into place ahead of getting a flare, which helped me. Knowing that there is a program in place for me personally when I do have a flare helps me get through those flares.